Good evening and welcome to Texas Alcon headquarters. Tonight we are excited to be introducing the Clareon PanOptix Pro. This is an Alcon sponsored event and all of the speakers tonight are consultants of Alcon. We are super excited. We all have personal experience with the lens over the last 6 to 8 months. So we're excited tonight to be sharing some of the science, our personal experiences with the lens itself. You also have a QR code where you are. So if you have questions, please use that QR code tonight. Ask us some questions. I'll be fielding the questions to our expert panelists tonight from across the country. We're super excited to be here this evening. So at this time, I'd love to introduce our panelists tonight across the country, from Florida to Philadelphia to Texas to Albuquerque. Let's start right here with Jennifer.
Thank you, Rob. It's an honor to be here with you tonight. My name is Jennifer Lowe, and I'm in a group private practice in Miami, Florida, and I focus on cataract and refractive surgery.
Right, and I'm Brandon Ayres. I'm from the Cornea Service at Wills Eye Hospital. I also have a private practice called Ophthalmic Partners of Pennsylvania. And there I serve as a cornea and anterior segment specialist for the greater Philadelphia area.
Awesome. Brandon's kind of a big deal, and I just want to highlight that. Brandon, you're in a unique setting in academics and private practice.
Yep, we bridge the gap.
Jennifer, you're in private practice primarily. And Morgan, go to introduce yourself.
Howdy, y'all. I'm Morgan Micheletti. I'm a cataract, refractive, and interventional glaucoma surgeon at Berkeley Eye Center in Houston, Texas, where we're also a very large physician-owned private practice.
Awesome. Yeah, Morgan's part of a very large practice, high volume surgeon. So everyone on the panel tonight has had experience with the PanOptix Pro already. I'm Rob Melendez. As I mentioned before, I'm in private practice. I'm a cataract and refractive surgeon. I do primarily premium lens technologies. I love what I do. All of us do. And I'm just super excited to really highlight some of the benefits of the new PanOptix Pro tonight with you. Before we do that, I do want to just give you some foundational principles about the original PanOptix, and we look at the Alcon's market share with the PanOptix. Of course, the PanOptix was launched in 2019, and the Vivity was launched in 2020. Alcon has the market share leader, and these numbers are based on extended depth of focus lenses, multifocal lenses, and of course the PanOptix trifocal lens. And in that area, Alcon has the market share of over 80% over these last 5 years. So PanOptix deserves a lot of credit. I oftentimes tell my patients that these optical engineers who designed this lens to allow you to see near, intermediate, and distance deserve the Nobel Prize. And believe it or not, Alcon has won the closest thing to it, known as the Prix Gallienne Award in 2021 for the PanOptix lens for its just superior technology to allow patients to see at all distances, near, intermediate, and distant. So hats off to the R&D team and all of the people at Alcon. The PanOptix trifocal lens, we know, is the #1 trifocal lens, not only in the US, but around the entire planet. There's been more than 3 million PanOptix lenses implanted thus far, and I predict that number is only going to continue to increase. Once we start sharing some of the results with the PanOptix Pro, we're going to see, I believe in my experience, a huge uptick in the upcoming years. So let's start with my colleague Jennifer Lowe from Florida. We oftentimes call her J-Lo in our inner circles. Jennifer, tell us a little bit about your experiences thus far in your practice with the PanOptix itself.
Well, thanks, Rob. Well, I've been very fortunate to have been using the PanOptix since its launch in 2019. And like you mentioned, it's been a wonderful lens. It's given so many patients happiness. It's given me happiness and satisfaction. And I think its success is attributed to the high quality vision. It gives it all ranges. And in fact, something I just recently thought of was, oftentimes as all of us surgeons, we try different technologies, of course, as we should. But I remember recently when I was going to try a different technology, my optometrist that I work very closely with, and she sees many of my postoperative patients as well, she just gave me a look and said, really? You really want to try something else? Because meaning that the lens is so good and the patients have been so happy with this lens.
That's great. I would definitely echo that. I think our patients have been extraordinarily happy with the PanOptix lens. Tonight we're going to learn how the PanOptix Pro is definitely better. All of us use different lens technologies. We've discussed that privately, so we're coming to the table just trying to be candid with our personal experiences so far with the PanOptix Pro. Brandon, share your experiences with the PanOptix Pro, maybe compared to some of the other competitor lenses.
Well, so jumping right to the PanOptix Pro, I'd have to step back a little bit and talk about our experience with PanOptix originally. Because coming from an academic center and a referral source, we tend to see the worst of everything, and we live in that world of pathology. And we dipped our toes in the water very slowly with multifocals. But then with the release of PanOptix, just like you see on the screen, you see that massive uptick in market share of PanOptix. Well, what we saw was that we finally had a lens that we could rely on, and that when we were describing what a patient would likely experience after surgery, they would come back with that experience with good distance, intermediate, and near. So we are still very happy with our experience with PanOptix, and now we have PanOptix Pro, and the presumption is with an improvement in the PanOptix, and for me, I was a bit nervous, like I like PanOptix. Do we really need to change it, right? We like what we know, but our experience so far has been even more positive with the PanOptix Pro, and I think over the course of our discussion tonight, we're going to see a lot of those reasons why that is.
Awesome. Thank you, Brandon, for sharing that. Well, let's take a little deeper dive and talk about the proprietary technology that Alcon has created, known as the Enlighten technology. We have one of our resident experts tonight, Morgan, who's done a lot of reading and studying about the science behind this trifocal lens. And I've learned from Morgan and in my own reading as well that this trifocal lens is not like other trifocals. So Morgan's going to tell us a little bit about why the PanOptix itself is different than just a regular trifocal lens.
Yeah, Rob, as you mentioned earlier, this technology won something that's akin to the Nobel Prize, and it's because of what they do here. So our original PanOptix lens, which we all know and love, is actually a quadrifocal, but they've taken the first order, in terms of the focal point, the first order focal point at 120 centimeters and pushed it to infinity, all right? Now when we do that, we capture 50% of light and focus it to distance, and the other 50% gets split between near and intermediate. But it's not just focused at a typical trifocal intermediate point of 80 centimeters, which would be less comfortable and potentially less meaningful to a patient, especially now in the age of cell phones. But by using a quadrifocal base and then adjusting the wavefront, we're able to capture a focal point of 60 and 40 centimeters for intermediate and near, respectively. And that really allows both comfortable intermediate working distance ranges as well as near vision for our patients.
Yeah, that's a really good point, and I didn't really understand that concept early on until now. With the PanOptix Enlighten technology, that intermediate distance is different than any other trifocal. The PanOptix lens itself has that intermediate distance at a very comfortable 24 inches. Near's at 16, but that 24 inches, that was huge how the ocular engineers were able to make that adjustment. So that was really an important tip there, Morgan. I appreciate you sharing that. Well, let's now get into the pie, so to speak. We're really excited to be highlighting some of the benefits and advantages of the new PanOptix Pro. My biggest concern was I didn't want anything to be taken away from the PanOptix, and nothing has. We're really just adding additional benefits, and we'll be highlighting those benefits tonight with the new Clareon PanOptix Pro. And we want to thank really everyone for joining us across the country. We have over 1,500 individuals across the country tonight, guys. We have some of our early adopters as well across the country who are also using the PanOptix Pro in addition to us. So kudos to you for helping your patients see at your very, very best. Now we have this newer technology. Morgan talked about the Enlighten technology, but now Alcon has created what's known as the Enlighten NXT technology. This is the technology that's been able to recover 50% of the scatter light that was lost with the original PanOptix. They didn't change the focal points in any way or the light distribution. They were able to recover that light loss scatter by modifying the structure just minimally while maintaining the structural integrity of the original PanOptix. so that patients still maintain the near at 16 inches, 24 inches intermediate, and distance, that full range of vision with the PanOptix Pro now. And of course, they recaptured the light otherwise lost to light scatter. It sounds very hokey initially when I heard this. Like, how did you actually do that without losing light? Did you move focal points? Morgan, can you really dive a little deeper and explain to us what they actually did with the modification of the new PanOptix Pro lens?
Yeah, so building on the original Enlighten technology, we now have Enlighten in XT, right? And what this did, what they were able to do is make some very small yet significant changes to the overall shape in certain step heights. No more than a half micron in certain areas, but enough that they're able to recapture some energy, in particular around that 120 centimeter part that we used to push entirely to infinity. We're bringing it back, and that's bridging energy, right? Because the goal is to maintain or provide a continuous range of vision lens. And we do that by providing light focusing abilities from infinity all the way to near. And so with these small changes, we're able to enhance contrast in certain areas as well as reduce light scatter by focusing more light.
That's awesome. That's awesome. Well, we're definitely seeing a lot of benefits with our own patients receiving the PanOptix Pro. Let's dive in tonight, and we're going to really highlight 3 areas of the PanOptix Pro tonight. Number 1, 50% less light scatter with the new PanOptix Pro. We're going to really share our own personal experiences and talk about what that really means to our patients. Next, we'll talk about the unprecedented 94% light utilization. What does that number mean? Well, the theoretical maximum light penetration of diffractive lens technology is at 96%. And the optical engineers were able to increase that from 88% in the original PanOptix to 94% with the PanOptix Pro, which is remarkable. And we'll be talking about the benefits of increased light utilization as it relates to our patients' vision. And then lastly, we're going to talk about how the PanOptix Pro was designed for enhanced image contrast. We oftentimes hear lots of issues with contrast issues with multifocal lenses, with trifocals. We're going to see tonight, in just a few minutes, another benefit of the PanOptix Pro, and that's improved image contrast with some bench studies that the optical engineers conducted. So in your experiences, what was your initial gut reaction, Jennifer, when you heard that the PanOptix Pro was going to be, improve light utilization, decrease light scatter? What was your initial impression?
Well, my initial impression was excitement because I already felt very confident with the original PanOptix platform, but the fact and concept that we could actually improve light utilization and decrease light scatter was amazing to me. In eye care, we know that light scatter is bad. It induces a lot of problems with vision, and we want our patients, they're coming to us for cataract surgery, they have trouble already with night vision, and so we want to be able to provide them that high image contrast and that good night vision. So hearing about the less light scatter, improved light utilization seemed to me a win-win.
Awesome. How about you, Brandon? What was your initial impression?
Yeah, so my initial thing was a little bit of fear. Don't change it, guys. It's good. It's the #1 selling lens across the world. Like, why do we need to make it better? But you do. We always want to improve on things. And the first thing that came to mind was recapturing that light scatter. So we're taking half of that light and we're bringing it back into usable light for the lens. And so my thought initially was, well, that's great. Probably less dysphotopsias, less glare, halo, things of that nature. But that's not a major problem that I have with the PanOptix lens. But then the second thought was, well, wait a minute, if we're not losing it, we can use it. So in theory, if we're bringing back half of that light that was lost or scattered in the eye, we should be able to apply that to distance, intermediate, and near vision. So we should see, and hopefully we'll see, enhanced vision, especially in lower light levels. At least that's the theory. And so I went from fear to excitement when we finally got our hands on the new implant.
Awesome. Thank you for your comments there. Well, let's take a little deeper dive and talk about light scatter. We know with the PanOptix Pro, it has the lowest light scatter as when compared to any trifocal on the planet right now. It's at 94% light utilization when compared to the PanOptix at 88%. So it's a significant improvement with more light utilization, reducing the light scatter. To me, decreasing light scatter means more light to the retina, a better quality of image, whether it's daytime or nighttime. Jennifer, what's your experience or thought process on decreased light scatter?
Well, my hope and what I've been experiencing in my practice is that decreased light scatter is giving that better image quality. We've all had patients in the exam lane that can read J1 or J1 plus on the near card, but they'll still tell you that they can't read or that their vision is poor. And I believe that has something to do with the contrast and the light scatter that may be coming from some other lenses. So by decreasing that light scatter, I believe we're going to be getting better image contrast and that better image quality, that crisp, clear vision.
Awesome. Brandon, you had alluded to image contrast, but you also talked about some visual disturbances like dysphotopsias. In your experience thus far in implanting the PanOptix Pro, have you noticed any decrease with the dysphotopsias perhaps?
Well, our experience has been very good with the lens so far, and I think Jen's comments are well taken. And I had a patient just come in yesterday, right before our meeting here, who put your and all of our wishes into words, where she came in about just a little over a month after her bilateral surgery. And in questioning, and I think we're all asking extra questions to our patients right now, how are you doing here, how are you doing there, trying to figure this new implant out. Without me asking, she spontaneously said, I can't believe how good my vision is at night. And she was happy with distance. And by the way, yes, she was 20/20 and she was J1 plus, right? Those are just numbers. What matters is what patients say and how they experience the world after surgery. So without me asking any questions, it was just given to me. Awesome. This is great. I see everywhere, and I see really, really well at night. And those are words that I haven't heard with other lenses, especially when they were spontaneously given.
Excellent. Morgan, share your experiences as far as what you think that the benefit to the patient is with less light scatter.
I think it really comes down for me to patient happiness, satisfaction. A lot of that stems from dysphotopsias. And we know that there's no perfect lens, right? There's no perfect lens. However, PanOptix is pretty darn good, right? And when we look at the data from PanOptix, 99.2% of patients would choose to receive PanOptix again in the original clinical trial. We know around 91.6% of patients in a meta-analysis are spectacle independent afterwards. And so we have all this incredible data on PanOptix, and now building upon that, if we were to say, well, what can we do to make it better? We don't want to lose anything, but what can we do to make it better? A lot of surgeons would probably say, well, how can we make the dysphotopsia profile even better? And that was my hope, and so what I've so far seen in my own patients is that there's fewer reports of glare, halos, and starburst.
Now we're about to transition and talk about the next level technology of the PanOptix Pro. This is proprietary technology known as the Enlighten NXT technology. We heard from Morgan earlier describing the Enlighten technology and the benefit of that intermediate vision. You get near, intermediate, and great distance vision. So my initial concern with this new lens was that I just didn't want you to change anything. You got to make it better. And fortunately, they did, and we're going to highlight that tonight with this new NXT technology. They were able to recover 50% of the scattered light with just minimal changes in the design of the new PanOptix Pro, while maintaining the structural integrity of the original design, maintaining near at 16 inches, intermediate at 24 inches, and of course distance without any glasses. They're able to recapture that light otherwise lost to scatter. I'm going to ask my good colleague Morgan, how did they actually do that? And were they able to, did they change focal points, or how do they actually change the design itself?
Yeah, so these are all slight modifications that have really served to hopefully enhance what our patients are seeing by bringing back and reducing light scatter, right? So increasing overall light utilization.
We're going to stop one more time. I apologize, Morgan. We have some technical difficulty, and we'll get right back to you. Welcome back, friends and colleagues from around the country. We heard that we're up to 1,900 friends across the country. We apologize for the technical difficulties. We will have this available recorded, so you can always watch it later. But let's dive in a little bit deeper into this new technology of the PanOptix Pro called the Enlighten NXT technology. It's optimized diffractive structure really what it's doing, it's modified just the structure just a little bit, and I'll let Morgan dive into that in just a moment, without really compromising the structural integrity of the original PanOptix, which still maintains near, intermediate, and distance vision. So Morgan, tell us what they actually did to the design of the new PanOptix Pro to give us near, intermediate, and distance and make these other improvements.
Yeah, so the first thing they did was to make sure that they didn't change the overall continuous range of vision that PanOptix already provides. And that's extremely important, right? This is built upon the foundation of PanOptix, and it's building on it, right? It is additive. So by making small, very small, half-micron changes in certain step heights, and actually smaller, like reducing the overall step height in places, which is fascinating, we're able to recapture some light energy at the 120 centimeter focal point that we initially were pushing 100% to distance. We're able to recapture some of that in what's called bridging energy. And what that allows is a more continuous range of vision from infinity to near. And by doing that, we're able to, again, utilize more light, 94% of the theoretical 96% that a diffractive optic can provide, and reduce overall light scatter.
Incredible. Thank you so much, Morgan, for that great review there. Now we're going to focus on three main areas tonight. We'll be asking our panelists their personal experiences about some of the benefits of the PanOptix Pro, and that's number one, 50% less light scatter. What does that mean to you guys? We'll ask you in just a moment. Next, we'll talk about the unprecedented 94% light utilization with the PanOptix Pro. We know that theoretically with diffractive lens technology, the maximum that you're going to get penetrated through that lens is 96%. So the optical engineers from Alcon deserve an enormous amount of credit for getting that high of light utilization with this new PanOptix Pro. And then lastly, the other added benefit of the PanOptix Pro design was to enhance image contrast. And we'll discuss that as a panel tonight about some of our big concerns with multifocals and previous trifocal lenses about decreasing contrast. Now with the PanOptix Pro, we're seeing some improvement in that area as well. So let's hear from Brandon for starters. Brandon, what was your initial impression when you heard that the PanOptix Pro was going to give you these types of benefits?
So I was very nervous at first. Remember my story, you know, we were sort of dabbling our feet and finally moving on with PanOptix, and then we hear it's going to change, and your initial reaction is, you know, why do that? We're doing so well, just leave it alone. And then I started thinking about, you know, phase two, which is this utilization of previously scattered light. So we're able to cut down on light scatter and then, you know, hopefully make that usable light. So, well, we're so happy with PanOptix. Maybe by reducing the scattered light, we'll see less dysphotopsia, which really wasn't much of a problem I was having anyway. But hey, take something that's great and make it even greater. And then once you reclaim that light that was going elsewhere, you know, where do we put that light? Now that you have it, you know, now that we're not losing it, we can use it. And that's what Morgan was talking about, where now we can add light to distance, intermediate, and near, and we also have this far intermediate that I think we'll see later on.
What was your initial impression about the PanOptix Pro?
Well, my initial impression was very positive and excited. I felt like we knew the PanOptix was wonderful, and I had a great experience with it. But now if we can make it even better, we know in eye care, you know, light scatter is a bad thing. And any surgery we do, and any prescription we give, scattering light is not considered a good thing. We want more light to hit the retina. And I've often wondered, as all of us have, why sometimes we have patients that test well in the exam lane, but still tell you they can't see. So we know that something must be going on, and we often believe that that light scatter, that decreased light utilization could be contributing to this poor image quality. So my hope, and what I've been seeing in my personal experience, is that almost immediate improvement in the visual quality. And again, not only are they seeing well on that eye chart, but they're actually seeing well in the real world. And like you had mentioned earlier, numbers are just numbers, but what really matters is how our patients see and how they feel. And so I've been very excited.
That's awesome. I would also echo that. Do you want to add something to that?
Well,
Brandon?
we had a recent experience in the office that just reminds me of what Jen was talking about, where a patient came in about a month after her bilateral PanOptix Pros, and we've been talking about some of this theoretic advantage of gathering previously scattered light and adding usable light, and she vocalized it just perfectly. And I know we're all adding or asking some additional questions to our patients as we're investigating this new lens. How are you doing with this and with that? But without me really asking anything, she spontaneously just told me that she was thrilled with her vision and she was 20/20 and J1 Plus on paper, but she actually didn't say she was J1 Plus. She said, I can see so well at night. She's like, I can't believe my night vision. And that right there puts the benchtop science into the clinic in our patient's experience, and my experience with this lens, where just that little bit of additional reclaimed light can be life-changing and vision-changing for our patients.
I think that's a really important point, Brandon. I think as a surgeon, we obviously want surgeon satisfaction. We want the J1 Plus, the J1, the 20/20, 20/20 Plus at distance. That's our satisfaction. That's sort of our report card. But a patient, we also want high patient satisfaction. I think as we've all talked privately with the PanOptix Pro, if we really dive into the data and we look at the FDA data and we find that at 6 months, 4.8% of individuals were adversely affected by starburst. Wasn't 30%, as most people say, 4.8%. Glare and halos was less than 3% at 6 months. So it's really not that high. Early on, it's probably fairly high with any lens, even a monofocal lens. We don't really talk about that, but if you look at the DFU of a monofocal lens, there's also risk of glare and halos with any lens. But just educating patients, letting them know what to expect. I think with the PanOptix, my verbiage or my scripting would be, it's going to take anywhere from 1 to 6 months. Those symptoms should improve. I've been using the PanOptix Pro for almost 8 months now, and I can tell you that conversation is different now. It's going to be even less than the 6 months that I'm seeing in my own personal experience. So I'm very excited with the early results already with the PanOptix Pro.
We've all wanted patients we've all said the words ourselves, probably 20 happy, and our experience so far is 20 real happy.
That's cool. I love that. I love it. Well, it looks like we have a question from the audience. If we can get that through, and as it comes in, I'll pose the question to our panel. But these are the 3 areas that we'll be focusing on tonight. Of course, decreased light scatter, increased light utilization, as well as improved image contrast. Those are our 3 major pearls tonight for our audience with the PanOptix Pro. As more questions come in, I'll sort of just sprinkle that in with the panelists tonight. So we'll move forward just for a second, and let's talk about this decreased light scatter. The PanOptix Pro has the highest light utilization at 94%, improved from the original PanOptix, which was 88%. That's impressive. So let's move to our question from one of our audience members tonight. First of all, thank you for using that QR code wherever you are to pose some questions. When we're done with our session tonight, you'll have an expert in your area there in the room that you're in to answer some deeper dive questions. But the question tonight is, please tell us the length of time post-ops you're following. How long have you been implanting? We'll start with Morgan.
Yeah, so I think we'll get into this a little bit later on tonight with some of the case studies as well, but I've been using for a similar time as you, and so I do have 6 months data in terms of postoperative data. Some of the data I'll present later today is at 1 month postoperatively, but again, given my experience that I can contrast this with being my extensive PanOptix experience, I know about what a PanOptix patient looks like at post-op month 1 and at post-op month 6, and so I'm able to recall that experience or call on that experience to compare my PanOptix Pro outcomes.
Okay, thank you. Brandon?
Yeah, I think I might be the newest one here, I'm not sure. I believe that I put in the first implant in the Northeast, and that was somewhere around mid.
Are you bragging right now, Brandon, that you were the first? Okay, just throwing that out.
Yeah. I'm the first Brandon. But yeah, so I have about 3 or 4 months of follow-up on our patients so far. PanOptix Pro.
Okay. How about you, Jennifer? How long have you been using the PanOptix Pro?
I'm also the same as Brandon. I've also have a 3 months experience since I started in mid-February.
So we got about 6 to 8 months, 3 to 4 months. We're also doing some studies looking specifically at refractive outcomes, visual outcomes as well. There's another ongoing study looking specifically at image contrast or contrast sensitivity. Some of that data will be coming out in the upcoming years. We're speaking from our personal experiences. We're all high volume surgeons. We do a lot of the original PanOptix lens, but now we can compare firsthand with the PanOptix Pro and the PanOptix. And that's what we're really sharing with you tonight to highlight some of the benefits. We obviously know that there's less light scatter. We know there's more light utilization, but how does that really translate to the patient's satisfaction? And it's been overwhelmingly very high for me. And based on what we've discussed earlier, it sounds like you guys are experiencing very similar outcomes across the country, from Texas to Florida, and of course Pennsylvania, and of course New Mexico. And a big shout out to Plano, Texas, for our friends in Plano. We might crash your watch event later tonight. So let's take a little closer dive and look at another benefit of the PanOptix Pro, and this is unsurpassed light utilization. So these optical engineers were able to harness that lost light and then increase the light utilization through this lens to 94%. That's extremely high. It's the highest on the market with any lens in the world. And even if we look at the original PanOptix at 88%, that's still in first place, and they made it even better. And when we look at some more common trifocal lenses that we might be familiar with in the US, such as the Invista Envy, that's at 86%. And even the original PanOptix is higher than that, but now we're up to 94% light utilization. Jennifer, what's your perception of what increased light utilization means to your patient's vision?
Well, I think it does mean that the image quality will be better, contrast should be better, and also nighttime activities or dim vision activities should be better as well. We know that more light to the retina is a good thing in terms of vision quality. And also with the PanOptix platform, it's not pupil dependent because it's a non-apodized surface. And I'm hopeful, and I've actually been seeing this already currently in my 3-month experience, that patients will see better at night while they're driving. They'll see better in those restaurants. And again, this provides our patient with that full range of vision with all activities. Most patients don't just do activities in the daytime. We're having, patients are more active later into life. So our typical cataract patient now is not staying at home. They're going out, they're driving at night, they're going out to dinner, they're going out to events. So it's important that we give them this good night quality vision.
Absolutely.
Awesome. Brandon, what was your initial thought when you said, when you read or you heard that the PanOptix Pro is going to give your patients more light? What does that mean to your patient satisfaction?
So, I mean, I can even tell you what our patients are saying back to us, but that improved utilization and increased utilization at night makes, I think, the most difference from what I'm hearing so far. Our experience has been at the low light levels, just like Jen was talking about. When lights are up, a 6% improvement doesn't make maybe that much of a difference. But when those lights are dim, you need every little bit. So those dimmer activities, the menu, driving at night, are likely going to be enhanced. And so that's where I thought we would probably see some advantage with PanOptix Pro. And so far, that's been the experience of our patients. So at first I thought it was going to be no big deal. I'm like, whatever, a little bit reclaimed light. But in the real world, in the clinic, what I'm seeing, it makes a big difference.
Awesome. Well, thank you for sharing that. Let's take a deeper dive now. The ocular engineers have done numerous bench testing, and this is one example of one of the bench tests that they've conducted. And this is really, we'll spend a little bit more time on this slide explaining what it means. We're going to just really highlight, particularly on the PanOptix Pro initially. This was a bench test looking at the light energy with light shining through the PanOptix Pro, and as you can see, there's this uninterrupted light distribution of the PanOptix Pro, and we'll compare this, and I'll ask the panelists to kind of compare and contrast the Pro to some of these other lenses. Before we do that, let's ask our resident expert panelist, Morgan, to really explain some of the science behind this slide.
Yeah, so I love this figure. I think it's a great way to look and compare lenses in a benchtop setting. And so I think an easy way to think of this, because this is a point spread function, right, showing light distribution, is to imagine taking the same apparatus and affixing a lens to it, shining light through it, and whatever light is focused on the other side is shined through, let's say, a fog. All right, and if you think about being a kid, shining a laser light through a fog and seeing what it look like. Imagine doing that with these lenses, but having an overhead view where you have infinity to near, right? In this case, minus 2.5 or minus 3 is what's on this distribution simulation. And when we do that, we can see where light is highlighted the most. And so brighter areas mean more focused light. And in an optimal situation, we'd see this continuous light distribution from infinity to near. And when you look at this figure, you can see there's one lens that really does stand out more so than anyone, and it's PanOptix Pro. When you look at PanOptix Pro compared to the original PanOptix, that little difference there is that 120 centimeter zone right around that first order that was initially pushed to infinity with the original Enlighten technology, but with Enlighten NXT, we're bringing back that energy as bridging energy, and that's what you're seeing here. That means more contrast and less light scatter. And
it looks to me that it's more of a continuous range of vision. There's not really like a break like with the original PanOptix. You see a break there at that far intermediate with the PanOptix. You don't really see that with the Pro. Brandon, what's your impression on this with the Pro, maybe versus one of the other lenses?
Well, this is one of my favorite figures to look at because it's super visual and you can really see what's going on, and it's fairly easy to understand. But just look at all of the other lenses, including the current PanOptix, where you have these skip areas or areas where light isn't focused. And that's going to be essentially where a patient says, I don't see well at this distance. And with the PanOptix Pro, you see a pretty near continuous line of light, which would imply that they've got good vision at everything from distance up till about 40 centimeters. And it is even better than the current PanOptix, which was my fear. Like, don't change what's good.
Right.
But they did it, and they made it even better. Love this image.
Thank you, Brandon. And this will be a nice transition for a question from one of our audience members across the country. Thank you for joining us live tonight. The question that's come in tonight is, how would you explain the differences between the original PanOptix to the PanOptix Pro to a patient that's coming in? I know, Brandon, you're going to be sharing a case study and your specific patient.
I did this.
Yeah.
I had to call the guy.
So how do you explain the differences between both lenses when a patient comes in?
So sometimes my infectious excitement takes over, and it doesn't matter what I say, they just know I'm excited about something. But I had to call a patient because he was on the schedule for PanOptix, and I wanted to put a PanOptix Pro in. So I called him and said, hey, look, we've got basically an update of the lens that we discussed in the office. There doesn't appear to be any downside to this lens. There's only upsides, and I think it may enhance the vision even beyond what we discussed in the office. And he said, Doc, do you want to do it? And I said, I think it's a good idea. And he said, let's do it. I mean, it really wasn't a difficult conversation because there's no compromise. And I was using a platform that I was already very comfortable with. So I think the patient sort of heard my comfort level with the existing technology, and then we were just adding to that. So for me, it was a very easy conversation. And I haven't had anybody say, nah, stick with the old one. Let's go with that. They've all opted for the Pro.
How about you, Morgan?
Yeah, so for me, when I was first transitioning from PanOptix to PanOptix Pro, I certainly was in the same position as you, where I would let the patient know, hey, there is an upgraded version or updated version of this lens that's existing. Now that it's in my armamentarium, it's not something that I'm saying, that I'm addressing with patients, hey, we have PanOptix, we have PanOptix Pro. If you're seeing me, you're getting PanOptix Pro. And that's, I think the other thing to keep in mind is that in having these discussions, as you start using this lens or converting your patients from PanOptix to PanOptix Pro, as your consignments and things change, it's easy to just have that conversation and say, hey, look, it's just a simple upgrade. But the biggest thing is that there's still no perfect lens, right? This is not a perfect lens. It's still a diffractive technology, but it builds upon a lens that already is excellent, right? 99.2% of patients would have the lens again from the original PanOptix. 91.6% of patients are spectacle independent based on a meta-analysis done by Dagny Zhu. So we see lots of incredible things with PanOptix, and this is building on that. And so I think it's an easy conversation to have to lean into some of those. I like data. So leaning into that data and those statistics when you're talking to patients, this was the original platform. Now this builds upon it, and you can even show them this slide. I think this slide right here is such a great thing to show patients if you're trying to, figure out how to counsel them.
How about you, Jennifer? What would you tell a patient that's kind of toying back and forth between the PanOptix and the PanOptix Pro?
Well, it's a good question. I'm like Morgan and Brandon, where I'm not necessarily going to be talking to them about this subtle difference. I'm giving them my recommendation on what I think is the best lens for them. And right now, if they're a candidate for multifocal, I think it's the PanOptix Pro. However, if I were to describe the difference, I mean, even just showing them this light distribution, this is a visual representation of a defocus curve, and you can see that the PanOptix Pro is not taking anything away, it's giving more. So I think just explaining to patients in a simple manner that I've trusted the PanOptix platform for 6 years, and this is the next generation version of the PanOptix. So that's how I would describe it, simply with confidence and just explaining that I think their visual quality will even be better.
I love your surgeon's confidence there. And I think patients can, they can pick up on that. And so the more that you use it, the more you're going to learn about it. All of us have used the original PanOptix for many years, since it's been out since 2019. And I think that it's a little easier for us to go to the upgrade PanOptix Pro. For me personally, I would say that you're still going to get great near 16 inches, intermediate 24 inches, and infinity. But in my personal experience, what I've seen in about 80 cases, and we're gonna transition in just a moment to about talking about improved image contrast, and what I've heard from patients, and I'm trying to really probe them. Like, I'm in a solo practice, and I get to see my own post-op, so I ask them point blank, how's your nighttime vision, or can you read that menu at night? And I think consistently more and more patients are able to do that activity, reading a menu in a dimly lit restaurant. I think is better. There's going to be another study that's being done looking specifically at contrast sensitivity, and that data will be coming out within the year. So we'll continue to learn more. What we're already seeing, I think in our own personal experiences, is certainly an improvement with contrast, improvement with visual disturbances, both daytime and nighttime, while still maintaining that strong, high quality near, intermediate, and distance, that continuous range of vision that the original PanOptix has delivered for our patients consistently. So let's take a little deeper dive and talk about the other advantage of the PanOptix Pro. This was another bench test that the optical engineers conducted. This was really looking at an improvement with image contrast, and they found that there was an improvement with image contrast at the far intermediate and near, at 16% at the far intermediate distance, and then an improvement in 4% with image contrast. That's great. And I think to Brandon's point earlier, even if you can get just a little bit improvement, that's great. Brandon, what benefit do you think this enhanced image contrast is going to be for your patients?
Well, this is where I think that we are no longer hearing about these areas that I can't see. And again, patients don't usually come in, talk to me about how they don't have good contrast. They say, I'm having a hard time reading, or I can't see as well when the lights are down. They're just describing their quality of vision. I interpret that as contrast. And I'll take any improvement. I don't care if it's 1%, 2%, I'll take 4%. But I like that far intermediate improvement, because now you've got that better sort of continuous range where you're not going to have that sort of fall off at the distance. And granted, I don't have real long arms, so I probably wouldn't notice it, but dashboard of my car might be about that distance, so you're going to have that better range of vision. And I think that's what we're hearing, or I know that's what I'm hearing from my patient's experience. So I think that's where it really comes in. Less dysphotopsia, better range of vision, and I'll take any improvement in contrast.
That's awesome.
And if you're wondering about the 16%, where it comes from, the 18 and 20 and 27, 28, those are rounded numbers, which is why the math does work. Mm-hmm. It does work. I just wanted to mention that.
Thank you, Morgan. Appreciate that. Well, next, let's dive into some case studies and really share real-world examples. We didn't handpick or cherry-pick a specific case. These are cases that we would routinely see as any ophthalmologist across the U.S. would see in your own practice. I mean, in my practice, how I like to approach things is everyone is a PanOptix candidate until proven otherwise. If there's some pathology, obviously I'm not going to be putting the PanOptix trifocal in that specific patient. If a patient comes in with moderate glaucoma with vision loss, I'm not going to put a PanOptix. I'll choose a different lens. Could be a Vivity or a toric, something to that effect. We know as surgeons we have a lot of options now, but now I think we have a new leader, a new king of the hill, and that's the PanOptix Pro, based on our own personal experiences. So let's dive into some case studies. I'll kick it off, if that's okay.
Sure.
Then I'll pass it off to Morgan, and then Jennifer will be sharing her very interesting case, and then we'll wrap it up with Brandon and wrap up the evening. So we appreciate you joining us tonight across the U.S. of over 1,800 folks, friends and colleagues across the country tonight. So let's dive into this first case. This is my case. I'm based in Albuquerque, New Mexico, high altitude desert, a lot of sunshine. We got 300 days of sunshine, and so we rarely get any clouds. And if we do, they're just for looks. So we usually have a lot of blue skies. It's a beautiful place. Looking for somebody, call me. So this particular case was a very interesting guy. I love this guy, super happy. 77-year-old gentleman. He presented just with a 2+ NS cataract, was symptomatic, was interested in being independent of glasses. As you can see, based on his refraction, there was a latent hyperope, and he recalls never needing glasses until he was about 45. And then he started to need reading glasses, and then he said, then I was about 55, then I just needed glasses for everything. So he remembered the days when he didn't need anything, and he wanted to go back to those days, and he asked, is there something for me? And I love that question, and of course the answer is absolutely yes. And I said, as a matter of fact, there's something even better for you that just came out that I'd love to offer to you. It's called the PanOptix Pro, and I shared it with him. He has a second home on a lake, loves to fish, and would just love to wear polarized sunglasses to reduce that glare off the top of the water. He told me that he would wear his thicker glasses and then put sunglasses over his glasses when he had fished. Imagine all of the visual disturbances with that combination. So he elected to proceed with the PanOptix Pro in each eye. He had a very normal eye exam, normal OCTs, retina looks great, normal corneal service. I do tear film osmolarity on all of our consults to determine any evidence of dry eyes to really maximize that postoperative refractive outcome. And I'd challenge you to make sure and address that ocular service beforehand, because that can impact that biometry reading and that can impact that postoperative refractive outcome. So his results after surgery, he was super thrilled. 20/20 +1 in each eye, quick and fast, intermediate J1, near J1+, just like the regular PanOptix. He reported minimal nighttime symptoms, and I was pushing him. He's a family friend. I'm like, how's your night vision? How's your night vision? It's fine. Why? Like, why? And he just wasn't bothered at all with his nighttime symptoms early on, as opposed to most multifocals and other trifocals. They might complain of some nighttime symptoms a little sooner. It might take a little bit longer for that to resolve. And I think we're gonna find, just based on our earlier experiences, that some of these nighttime symptoms are gonna go away a little bit faster and be less noticeable early on, so far that I've noticed. So he was very, very thrilled with this outcome. It made me happy because he's happy. And I think that's what builds our surgeon confidence. So when that next patient comes in, assuming they have a healthy eye, this is a great recommendation for those patients who want to be less dependent upon glasses. So the Clareon PanOptix Pro now is my go-to lens, like Morgan. That's what I'm primarily using now. It's going to be available to everyone across the U.S. It's going to be delivered preloaded now, by the way, through the autonomy device. So no one's going to touch that lens. You're not going to have that risk of anyone potentially scratching that lens. So Alcon has really dialed up this entire process, improved the lens, overall while maintaining that near, intermediate, and distance vision. I'm super happy. I'm pleased. It's my go-to lens, period. I have a very high conversion rate to premium lenses. 80% of what I do is the PanOptix lens consistently. I have a lot of family members that have received the PanOptix, including my lawyer, and he's still very, very happy. So let's go ahead and transition. I'm going to have Morgan share his personal case. Morgan?
Yeah, thanks, Rob. So with this case, really what I wanted to look at is not just one case, but a collection of cases. As I mentioned, and if you know me, I really, really like data. I want to see the evidence. And while this doesn't get too deep into the actual, it wasn't measured in a research lane, but it's at least something, it's some data. So yeah, but before we do that, I do get a question frequently, does it look different? Does PanOptix Pro look different than PanOptix? Well, this is PanOptix, and this is PanOptix Pro. And so to me, I see a difference. If I look through some of my surgical videos and I don't know which lens it is, and I'm just clicking on a case, I can typically call out which lens it is. So I do think there's a difference, and I think that that speaks to the fact that there is a change. This is not just hey, we're going to throw some numbers out there and no, there's an actual change, half micron changes in step height in certain areas.
Hey, can I ask you a question about
yeah.
the pictures?
Yeah.
Are you asking your patient to look at the light? Is that what you're doing in this step here?
I typically will. It depends on if you're using coaxial and paraxial lights, it doesn't always work perfectly. So I'll still use a digital centration system as well for visual access.
Your Purkinje image looks dead on.
Yeah, and so I do like looking at my Purkinjes, but I typically lean more on my digital markers.
What if it's not pre-op? What if on your topography or your aberrometer, they've got a little bit of a larger kappa or alpha?
Yeah, it's something that I was asked a lot with original PanOptix, and I think it was kind of all the rave in the late teens. It's not something I really look at anymore. I mean, angle kappa, angle alpha, chord mu, I mean, if it's like off the chart and kind of crazy, or maybe they had if it's a post-refractive patient, it's a different story, but in some of those extreme cases, maybe it's something I'll glance at, but for 99% of my patients, it's not something that I'm even looking at. And same thing with pupil size. This is a non-apodized lens, so it's not pupil dependent. And for me, it's something that I've used across the board without any issues. And retrospectively, having looked at lots of cases and lots of outcomes and even analyzed, which patients may or may not need an enhancement or which patients may do well, there doesn't seem to be any correlation with angle kappa, angle alpha, chord mu.
Yeah, and I would echo that, Brandon. I mean, early on with the PanOptix in 2020 and 2021, I was very aggressive at not putting the PanOptix with patients with high angle kappa. And then what I found over time, there really wasn't much of a difference. And I stopped really measuring that. And I actually have put the PanOptix in patients with higher levels of angle kappa, and they still did very, very well. So I just don't pay much attention to that, with the rare exception when it's extremely high. That's a different, or post-refractive, where there's some decentration of a flap ablation, or ablation rather.
And now this isn't a Unity talk, but actually if you look at that slide, that is with the Unity phaco system, I do want to call attention to that CDE number up there in the top right-hand corner.
So
not bad,
yeah.
not bad.
Like Trace NS, or I mean.
No, this is legit. This is a Texas cataract. This is we're not in Los
4+.
Angeles here, but no. So let's go ahead and move forward with the next slide here. So what I did was I looked at 19 patients who were at least post-op month 1. And I went back. Now this is anecdotal in the sense that it's not measured in a research lane. It's not measured in a 4-meter lane on an EDTRS chart. This is looking at what my techs actually put in the just in the clinical lane, just in the office lane, Snellen, and then I converted it all to Logmar and averaged it. And what we see here is basically it's effectively 20/20, right? That's 20/20 minus a half and 20/20 minus 1. At distance and near respectively. But what speaks to me more than that's what I would expect with PanOptix. But what speaks to me more is that I'm not seeing patients back from my ODs, right? So there's 38 ODs in our practice that we work with that are all internal, and so I can see all the data. I'm not seeing referrals back for patients. And I think that's important, right? And that's with 6 to 8 months of experience. I'm not having a patient come back and saying, I'm really dissatisfied, I need an IOL exchange. I have not done an IOL exchange yet with this lens. And the overall feedback from the optometrist is just overwhelmingly positive.
That's great.
And so with that kind of summarizing here, I think the important thing to highlight here is the seamless transition. For me, it was plug and play. So when I converted from PanOptix to PanOptix Pro, it's the same A constant for me. I use an optimized A constant based on my own outcomes. But it was plug and play from the beginning. It's not something I had to think about. It was this patient came in and was going to get PanOptix. Now they're going to get PanOptix Pro.
That's great. Thank you, Morgan, for sharing that very interesting case. We're going to hear from Dr. Jennifer Lowe and hear about your interesting case.
Thank you so much. All right, so I'm honored to present this case. This was one of my first PanOptix Pro lens implantations. He's a 68-year-old male who came for a cataract consult, mild hyperopia and presbyopia with cataracts. And you can see here his refraction with some astigmatism, and he obviously had some worsened vision with glare as well. He did have a prior history of having a pterygium removed and otherwise had a normal ocular exam. Interesting with him, however, is that he did want to have very good night vision because he did fly. He was a pilot, semi-retired, but was actively still flying, and so he was concerned about, that night vision. But he also wanted to have really good near vision as well. So we talked about many of the different lens platforms, some of the newer ones that had come out as well. But I ultimately told him that I have the most experience with PanOptix and I had been having great results. And then this was the latest and greatest generation of PanOptix, and we decided together to go forward with it. So you could see here, I did use the Argo Smart Cataract to plan for the surgery. And based on Steve Schellhorn's data and his large database of patients, we really want to target patients closest to plano. So that is, I don't go for first minus necessarily, I go for closest to plano. And the nice thing with the PanOptix and the PanOptix Pro lens is you don't have to intentionally target that first minus to get that good near vision. And so with him, as you can see on the Smart Cataract, I picked the 19.5 diopter lens. His left eye was the dominant eye, and so I chose that to be first. But again, with the PanOptix and PanOptix Pro, I'm not really worried about dominant versus non-dominant because I know they're going to get that good distance vision. On day one, he was 20/20 and J1+. And I think, like you were mentioning earlier, Rob, it's just that immediate, sudden improvement in the vision. Even on day one, they're seeing really, really well. And you can see at his week one, his refraction was as predicted. I was also pushing him. I was asking him because I was very interested, like, what's the night vision like? Do you see halos? Of course, I warn my patients about halos ahead of time. And he was a very analytical person, of course, right? And he did say that he had one mild halo at night a week after surgery, but it was not disruptive. He was more interested in it because we talked about it so much, I think. He was overall very pleased with his results and was eager to proceed with the second eye. One other anecdote, as I was actually operating on his second eye, he said on the table, "I can't believe the small things I'm reading with my new eye." Cool. And so that was really, really exciting. And kind of like your story about the distance, or the night vision being good. Like, how often in the past were we hearing people like saying they couldn't believe how well they were seeing for reading, right, with a multifocal, and just hearing that really was a huge game changer for me. For the second eye, his right eye was performed 1 week later. You can see my image of the Purkinje.
Your image looks better than Morgan's image.
Well, I wouldn't say that, but thank you. And he was very happy overall, spectacle, independent both day and night, and just very pleased. So my PanOptix Pro experience, I have confidence that I'm going to give my patients that full range of vision. They're going to achieve that spectacle independence, and they're also still impressed by the quality of their vision and how well they can read. All right, I'll pass that on to Brandon.
All right, thanks, Jen. So do you guys probably have these patients? This is my case. Do you have that patient that you can hear the moment they walk into the office? Like, yes. This guy's just loud. Happy guy, I love him, but when he comes in, he's like, "Hey, everybody!" So that is somebody who you want happy, because they're going to announce it to the world. So this is my 71-year-old patient. This is my first PanOptix Pro patient. This is the first PanOptix Pro patient in the Northeast, I think. He is this is the old, like the 71 is the new like 51 or whatever it is. Like he's young and active. He likes to hunt, fish. He actually mentioned, he's like, what kind of polarized glasses do you wear when you fish? I got to see them under the water. Gardening, loves spending time with his kids, but he's had a progressive decline in the quality of his vision, and he's got a real cataract. I think that picture kind of shows that he's got some nuclear sclerosis and some cortical lens changes that are really going to affect especially his nighttime vision. He's never had any other surgery. It's the normal stuff. He's had some elevated cholesterol. He had a squamous cell carcinoma taken off. No, what you guys don't know is that this is the most atypical patient in my office. There's no iris defect. There's no Fuchs dystrophy. He hasn't been hit with a baseball. I'm like, I got to knock this out of the park because this is my opportunity.
Just trace NS.
Just trace NS. Yeah. So there's this video moving. I mean, it's a real cataract. But we all see these patients who don't complain much about their vision, but he glared down, significantly. 20/30 with correction, but it glared to about 20/80, and he just wasn't doing well with his glasses. All right, there we go. So this is the old don't judge a book by its cover. He's a loud guy, he's boisterous, I'm talking to him, really an enjoyable guy, you can joke around with him in the office. And I misread him because I go through everything with the patients. You have a cataract, it's going to reduce your vision. I show him a picture of a cataract. It's like an M&M with a candy shell, and I really thought that in the end he was going to give me the old, well, whatever insurance covers is this, that's what I'm going to do, because that's how it's going to be. And he actually came in, and after our discussion, he's like, I don't want to wear glasses. Why would I want to wear glasses? And in fact, I think he had a friend who had cataract surgery, and I don't really typically mention IOL brand in the office very much. I may say trifocal, but I stay away from brands. He wanted the PanOptix. So this is the patient who I had to call a day or two before surgery and say, you know what, I think I've got something that might be a little bit better. So this is that phone call where, hey, patient, I think I got something better. Do you want to do it? And then I could hear him. I didn't even need the phone. I could put it down. I held out here. He's like, yeah, if you think it's better, let's do it. I want to be independent. I want to be able to drive my kids around. And that was his big concern. He just wanted to enjoy his life and be able to see his grandkids and spend time with his family. Normal exam, again, atypical for me. He's got very little astigmatism. There's no keratoconus. This is beautiful. Macula looks good. Pretty hard to read here, but what you're seeing is there's little astigmatism. I was able to get away with basically a spherical lens. And he is as happy as can be. I'm showing you real data. I got him 20/25 in the right eye. All right, sorry guys, not 20/20.
No, that's
he's
great for
J1
Brandon.
plus OU. That's great for me. Yeah, usually they're like 20/40 for me. I'm pretty happy. Minimal manifest refraction, a little bit. He's pretty close to plano. I thought that we did a very nice job. And I was nervous when this guy was coming into the office, just because he is loud. Like he's going to make an announcement in the OR. Dr. Ayres did my surgery, and it is, and you fill in the blank. Great, terrible. I'm so mad at him. He was thrilled. He's now the guy who is like telling everybody to be quiet. Like I've been waiting an hour. He's like, you'll be okay. I can see so well. He's our best candidate, and he can fish now with this polarized lenses. He can see under the water. And he was showing off because he was talking about how he can actually read a menu in dim light, and he can read that menu better than his son. Mm-hmm. So he has been my biggest proponent of surgery. I learned a lot from him, and he gave me a great opportunity to use the PanOptix Pro. And I think he is the perfect example of if you want to try a new lens, try a new technology, go with PanOptix Pro. He's already done, so you can't use my patient. Okay, he's mine. But that type of patient that did really, really well. Nothing tricky, nothing fancy, regular old cataract, good person, great result in this case.
I love those real world case studies tonight. Thank you all for sharing that. We have some questions coming in. I do want to just summarize for tonight, but before I do, have you guys put in a PanOptix Pro in one eye and a PanOptix in the other eye?
I have. So some of my early patients that came in, I kind of offered them that, hey, we've got this new upgrade to this lens. I know we've already done one eye. Do you want to go for it? I don't expect you to be able to necessarily just kind of close one eye and tell a huge difference. But there may be some, nuanced differences in your vision. So, it's not what I would recommend to a new user. If someone's going to come in and say, hey, I want to try a trifocal for the first time, or, a surgeon's just getting started with this technology, I think it's probably best to go ahead and start with the first eye. I'm very comfortable with the PanOptix platform, and so I felt very confident going ahead and doing the second eye with PanOptix Pro, but that's really kind of a surgeon-based decision.
Absolutely, and of course there's no contraindication for putting a Pro in one eye and original PanOptix in the other. I know a lot of us have probably a mix and match of Vivity and a PanOptix and so on, with great outcomes with the Vivity in that dominant eye and the PanOptix in the non-dominant eye. Time will tell. It's still very early. I think my go-to at this point is just to be consistent, use the PanOptix Pro in both eyes, and just to get some more real-world experience. So far, it's been very, very good. What I'm going to do now is just kind of wrap up, summarize what we've talked about, some of the benefits of the PanOptix Pro, and then we'll open it up to our friends and colleagues across the country for your questions, and we're curious to hear those questions. You also have some experts in your watch events that will dive a little bit deeper into some of the deeper scientific questions that you might have about the latest technology with the PanOptix Pro. But really just some key take-home messages with the PanOptix Pro. Of course, number one, increase light utilization. More light means better quality image, more light onto the retina. I think that's number one. There's less light scatter. What that means to me, and what I've seen personally, is with less light scatter, we have more focal light onto the retina, just like with increased light utilization. I think we're seeing that right out of the gate with fewer symptoms that patients are reporting after their cataract surgery. So that's been really good as well. Clinically proven low visual disturbance profile with the PanOptix Pro. And then, of course, most importantly, outstanding spectacle independence. Can the patients really do what they want to do? Can they see their phone, and can they drive and see at a distance? As surgeons, we're more concerned about the numbers, but I think, Brandon, you hit the nail on the head, and you said it's really more about, can they do the things that they want to do? And the answer to that is absolutely yes. They can do it with the PanOptix, but now they can even do a little bit better with the PanOptix Pro. Undeniable patient and surgeon satisfaction. I think you guys have all shared your personal experiences, and I can even tell that your surgeon confidence, although it's already been high, it's already higher. And I think our listeners tonight will also gain that increased surgeon confidence that you will want to put this lens in patients that desire to be spectacally independent. It's a great time to be alive as a surgeon, I have to say. We have such great technology to help our patients. So another question has come in. We'll kick it out to our panelists here, starting with Morgan. Have you implanted the PanOptix Pro in patients with prior refractive surgery like LASIK or PRK and such?
I have, and I think that it's important to, if you're considering using PanOptix Pro in a patient who's post-refractive, obviously we're talking about myopic ablations, but I think it's important to ask yourself, well, were you doing it already with PanOptix? And what was your method of going about doing it? If you were comfortable using it in post-refractive cases with PanOptix, this should, again, be plug and play. I mean, for me in particular, I want to make sure that it's a well-centered ablation if I'm going to consider it. Again, a myopic ablation. And then the other thing I look at is, in particular, the EKR and the distribution of the means. I want to see a nice tight spread on my Pentacam. Again, anecdotally, and some of the work I've done, those patients tend to have the best outcomes in terms of post-refractive patients.
Mm-hmm. Brandon, have you implanted the Pro?
So I'm trying to think, and I don't think I have, but it doesn't mean that I wouldn't. I've done plenty of PanOptix, especially in myopic LASIK, and for me, this has just become now the PanOptix Pro. It's an improvement. So I think if you're confident in using the PanOptix in a post-refractive patient, there'd be no reason why you wouldn't use the Pro. But I would just use your same algorithm or your same workup. And if you would say I would do a PanOptix, I think the Pro would work just as well or even better.
How about you, Jennifer?
Same here. I have not yet implanted a PanOptix Pro in post-refractive, but I have for regular PanOptix. Again, just like Morgan and Brandon mentioned, with the appropriate analysis, myopic LASIK, good well-centered ablation, and healthy eye otherwise. But yes, but I also agree with Brandon. I mean, there's not a reason not to if you're already feeling comfortable with the regular PanOptix.
Yeah. My next myopic LASIK patient who wants a multifocal lens will get a PanOptix Pro, if I deem that a diffractive optic is the way to go.
Sure. So in my personal experience, I've implanted a lot of the original PanOptix in myopic LASIK patients. I'm conducting a current study looking specifically at patients who've had myopic LASIK with the PanOptix lens. I'm looking specifically at the higher order aberrations, spherical aberration, trefoil, coma. I'm not going to share the exact numbers because it's a study, but those are really my core criteria that I'm looking at amongst some other data points. And I'm hoping to be able to stratify that and figure out what's that threshold of, for instance, a higher order aberration above 0.5, above 1, above 1.5, and look at the outcomes and see the refractive outcomes and the visual outcomes in those groups, and perhaps we can create some sort of new AI software that can predict that for us just based on the Pentacam, that they would be a good candidate for this or they wouldn't be, and to kick it out to us.
So I will say on that, there's not a specific spherical aberration threshold in which I would not consider PanOptix Pro. Like if a patient comes in, they have a spherical aberration of 0.5, 0.6, I'm not going to instantly say, no, this lens isn't for you. I don't think that's been well studied enough yet, nor is there a direct correlation with that to a negative outcome with a diffractive optic yet.
Okay. Thank you guys for just a wonderful night. And at this point, what I love to do is just have each of the panelists highlight one, unique pearl that you've learned about the new PanOptix Pro, something that we've learned maybe perhaps just from talking. And this has just been an amazing panel. You guys have done an incredible job tonight. They're all very high volume surgeons and have used the PanOptix and the PanOptix Pro in their own personal practices. So why don't we start with Jennifer here, share one or two pearls with us tonight.
Well, I think pearls are just how you speak to patients. Having confidence in the technology you're using will give you more confidence as a surgeon and being able to recommend the best outcomes for your patient. And that's why I've been really honored and excited to be using PanOptix Pro. So that's been a great pearl. And I think just listening to all of your stories, all of your data has really gotten me more excited and moving forward.
Awesome. Thank you, Jennifer. How about you, Brandon?
So, I'm not sure that I really have a pearl, but maybe a suggestion. Our experience so far has been that there's been no downside at all to using the PanOptix Pro versus the PanOptix. And so having the collective experience of the surgeons in this room, there's not a reason why I would say no to the Pro. So, if the next patient you see who's a good candidate, have the confidence to use PanOptix Pro. It seems to be a better lens platform, at least in our experience.
So, yeah.
That'd be a good pearl.
Good pearl. Well, I have a couple things. So I think, when we look at evolution and we look at what's come from that, all of the creatures on this earth have had binocular, continuous range of vision, at base in both eyes, right? It's not monovision. It's not, EDOF like it's continuous range of vision in both eyes at our optimum state. And so really what we're trying to do is get back to the most natural thing. And we've never been able to beat evolution in anything, but getting back to that is so important. And I think PanOptix Pro helps get us there, okay? Bilateral, binocular, continuous range of vision. The other thing I'll add to that is it doesn't matter if you told me you had a perfect lens that had 100% light utilization with 0 dysphotopsias, I am still going to counsel my patients the same way. And that, I think, is the biggest pearl that I can give is it doesn't matter how good you're told the lens is, I still tell my patients to expect to see glare and halos, and I'm hopefully under-promising and gonna over-deliver.
Yep.
Awesome. Well, once again, thank you to our expert panelists tonight. We also want to thank all of our friends and colleagues across the country for joining us tonight. You're going to have a breakout session in just a few minutes with your own team there. Ask lots of questions. We also want to thank Alcon and the entire Alcon team for working so hard to prepare for this in light of just finishing a national meeting, ASCRS, and really launching this huge event tonight with over 1,800, maybe 2,000. We'll find out what that head count is, but so many people have joined us tonight across the country. We want to thank you. Have a wonderful evening.